When the baby is already crowning, the immediate newborn care nurse will prepare the sterile gloves. And now he will do hand washing. After hand washing, the immediate newborn care nurse will do dual gloving technique. The second glove. Both gloves are sterile. Baby is out. It is a female. 10 a.m. Dry the newborn for at least 30 seconds. Do a quick test of breathing while drying. Do not suction unless the mouth, nose are blocked with secretions or other materials. Wipe the eyes, the face, the head, the back and front, and the arms and legs. Do not wipe off the vernix caseosa. Then move the wet cloth. After drying, position the newborn prone in mother's abdomen and chest. Cover the newborn's back with dry blanket. Also cover the newborn's head with a bonnet or a cap. After 1 to 3 minutes, properly time cord clamping. Remove the first set of glue. Check the umbilical position, and if it has already stopped, clamp the cord using sterile plastic clamp at 2 cm from the base. Do not milk the cord towards the baby. After clamping the cord clamp again at 5 cm using Kelly forceps from the base. In cutting the cord, the immediate newborn care nurse will now receive with a surgical scissor with an OS. He should place his hands under the cord with an OS on it to protect the vagina of the baby and also to prevent damage or injury to the other surrounding areas. In cutting the cord, when you use the surgical scissor, the blunt portion should be downward and the sharp portion should be upward. This OS will prevent the blood from coming contact with the baby's skin. Cut the cord. And then, if there's a little blood, you apply light pressure on the umbilical cord area. The immediate newborn care nurse will put ID band to the patient depending on the institution's policy. ID band should contain the gender of the baby, the surname of the mother, and the name of the mother. It also contains the date of birth and the time of birth. Lay the newborn in skin-to-skin contact with the mother. Observe for feeding cues including tonguing, licking, and rooting. Point this out to the mother and encourage her to nudge. The hand of the mother should be placed on the baby. After 90 minutes, remove the newborn from the mother's abdomen. Transfer the newborn to the work table. In transferring the newborn from the mother's abdomen to the work table, the immediate newborn care nurse should hold the neck of the baby while her other hand should hold the lower extremities. Weigh the newborn to the work table. Be sure to remove all the linens and even your bonnet. Weigh the baby naked in the weighing scale. In weighing the baby, your other hand should hold or keep watch on the baby to prevent from falling. Be sure to familiarize on the weighing scale. After weighing the baby, transfer to the working table, holding the neck area and the lower extremities. Then do physical assessment of the newborn and APGAR scoring. Perform the measurements. Check the head circumference. Measure the head circumference. Then the chest circumference. In checking the chest circumference, the tape measure should be placed at the top of the nipples or the nipple line of the body. Then check the abdomen. Then the mid part of the newborn. Then next is your body length. In checking the body length, the end portion of the tape measure should be on the occiput area of the baby and slide according to the curve of the baby's body, part up to the heel area. After the measurement, cover the baby's head with a bonnet or a cap. Then also cover her body with a blanket.